My name is Parul Shah. I'm a consultant geriatrician and I've been appointed earlier this year in February, so it's about 9 months since I've joined the St Andrews healthcare team in my capacity as a physical healthcare consultant. The role of a consultant geriatrician for a mental health institute like this is to pick up on subtleties of medical issues, preempt issue and actually do some proactive management so that patients don't deteriorate any further with their physical health and hence reduce visits to acute hospitals, improve their safety whilst they are under our care here, and generally improve quality of care provided to older people by practicing holistic care and comprehensive geriatric medicine reviews. The complexities of working in older patients group who have a mental health condition is the ability to connect with them, to make them understand why they need to be assessed. Sometimes they resist even a physical examination and they're not aware of why we are trying to approach them and go into their personal space. So one of my key intervention is to improve the overall sort of strategy for older people's health, particularly identifying frailty. Now, a number of older people are living with sometimes multiple conditions, and sometimes they gradually physically decline and people don't recognize them as they're getting frailer. And if we have identified that they're getting frailer, and we could put something in practice early on, such an exercise program, lifestyle changes, it may stop them deteriorating. And sometimes if they have a very advanced stage of frailty, then recognizing that they may be approaching end of life and making sure that quality of life has more importance rather than just keep doing a physical healthcare interventions. So I think that's one of my aim, is to improve recognition of frailty, providing comprehensive assessments to these people to identify why they're getting frailer, and if there are no reversible factors, then how to make them more comfortable and make the right decisions for them in their best interest by involving them. Having worked in quite a few organizations before, as a junior doctor, then as a consultant, I have, what I've acknowledged the most at St Andrews is there is a lot of compassion in care. The staff work really together as a team, and every time I walk onto the wards or any multidisciplinary meetings, I always feel that I'm working with team. And people are raising questions appropriately whenever they feel that something's not right, particularly if people feel that all the views are not heard, either the team members or patients or carers. There is always a wider and lengthier discussions around those areas. The fun fact about me is I do love Bollywood/Indian music, and I cannot withhold myself from dancing if there's music going on.